So 2 ways you can do it. You can either interlock your fingers if you're doing it on an adult, but that gets very painful very quickly, or you can do the butterfly grip. Yeah, and where roughly do you want your hand to go? Yeah, so between the nipples, sternum there, so draw a line across, you want your hand to go there. That's for levels of unconsciousness.
The sample.
Sample. Signs.
Symptoms.
Allergies.
Allergies.
Medication.
Medications.
Past. Medical history. Last meal.
You don't necessarily have to do it in this order. There's a very good structure for getting a very quick history. Because diabetes, he's having a silent heart attack. Diabetics, the tissue goes necrotic, they don't necessarily feel pain. He's short of breath, he's sweating clammy, he's getting progressively short of breath during the day. He's obviously got a cardiac history because of these medications. He's on statins because he's got high cholesterol, and he's on blood thinners because he's got some sort, he might have AF or something like that. So 3 cardiac drugs there. Diabetes is not a problem with the blood sugar levels, it's a circulatory issue.
Are you feeling okay?
Got this sort of tingling in my jaw. Down my arm. I've had the tingling in my jaw before when I've been stressed.
What's your hands for?
I didn't want to see that the rest of it at the weekend.
Push them towards
They're asking for your qualification.
Not feeling dizzy at all or anything?
No, I'm alright, thank you.
Has this come up during the day?
I did a little bit this morning and it's sort of gone away and then it's come back now.
And some of those machines
Generally sparks its anxiety with you.
Yeah, running training days, I think.
I think you're suffering from an anxiety attack.
Do you reckon? Yeah, perfect, yeah, exactly that. So the fact that it's sort of mitigated since I first got here, it's got better. It's heart attack,
So you're trying to rule those out.
my fingers were all tingly. That was the other thing I forgot to mention. Primary survey. Thank you. Right. Dangers. Response.
Shout for help.
bleeding.
And it's the airway that's
Breathing.
and circulation.
Where in particular could we see it?
Building areas.
Buildings. Yeah. What about where we are?
On the railway.
If you shout at them and you open your eyes and they open their eyes, they're alert to that.
Yeah, exactly. So you could either push it further in and cause more of a problem for yourself, or you could end up with your patient's got something called trismus. And trismus is a neurological response, as Neil was saying, where your teeth suddenly lock closed and they don't come back open again after that. Everyone happy with that? So head tilt back, open up, have a little look, see what you can see. If you can't see anything, then assume the airway's clear. Because you don't want to spend time, if there's not a visible obstruction in the airway, you don't want to spend time turning on their back if they're not breathing. First time we come across this patient, what are we going to do? What are we going to start off with? Yeah, so let's do our primary survey. So, dangers, what are our dangers? I'd say quite a lot of this area is a bit of a trip hazard.
Yeah.
I'd say. A bit sort of raised area around here. So, that's our dangers. Are we happy? Is there anything we can do to mitigate these dangers?
What is stop
Yeah, okay. Right, so who wants to take responsibility for that? I'm going to delegate. Mike, I would want you to take responsibility for stopping the trains, making sure that everything's sorted, please. Fantastic. Right, responses. Apu. Right.
Active, not active.
So is he active? Is he alert? What do we say? Not alert?
Not alert.
Okay, so what comes after alert?
Voice.
Hello? Can you hear me? Hello? What do you think? No? Okay. Pain? Little clavicle squeeze. Rub the ear. Press the finger. No response to pain?
No.
Okay, so we're saying
Unresponsive.
patient's now unresponsive. Okay, what comes after our response?
Check for help.
Yeah, okay, so seek help. So in this case, James, call an ambulance. Roger, go and inform the station master and duty operations officer what's going on, please.
Catastrophic bleeding.
Catastrophic bleed. Have we got catastrophic bleed? No?
To check underneath.
Happy, yeah, okay, so...
Airway.
Airway, right. How do you check the airway?
So listen.
Perfect.
So you then look down.
So for the airway, we're going to tilt back, push your jaw down a little bit and have a look and see if we can see any obstructions. I can't see any obstructions.
No.
Okay. So breathing, yeah, okay, so right, as you said, face down, looking at the chest, ear to the mouth. I am listening, looking and feeling. So patient's not breathing, so what do we do?
immediate
CPR.
Start CPR, yeah. Okay, right, so we've done our CPR, we've shocked them, patients come back to life, fantastic. Before we start doing that, let's now think about, okay, so we've sorted the majority of it out, okay. Whilst we're doing that, we're going to do all this sort of stuff simultaneously, so we've gone through our primary survey, great. What else do we need to be thinking about now?
Getting rid of all the people round.
Yeah, okay, so...
Giving some privacy.
Yeah. Yeah, okay, so let's get a screen around the patient. This would happen simultaneously to the primary survey, but we'll do one thing at a time. How do we think we're going to get control of evacuating people? How we... Yeah, exactly. So ladies and gentlemen, if I can ask you to follow me, please. We're dealing with an incident. We're going to head away from the platform and move our way into the car park. Just something like that. Nice, clear instructions. Don't complicate it. Don't give away too much details. We don't want to say we're trying to do CPR on a patient here and you're in our way. We're just going to say, ladies and gentlemen, if you can have your attention, please. We need to evacuate this area for the first responders. Okay, fantastic.
Would you have somebody writing everything down as well now?
Yeah, if we could get someone to scribe, so exactly. So we're going to start taping it off and making sure that it's obvious that this area is out of bounds. So should we go and do that? Yeah, perfect. Round. So this area is nice and closed off. You've got tape. You'd have someone stood here saying, okay, you can't come past this point. Sorry, we've got a medical incident going on. I'll stay there. How do we think we're going to get this lady onto the scoop? So we're going to roll the person onto their injured side. Is the gist of it. It sounds a bit odd, but let's say, okay, she's only broken her right hip, or yeah, so she's broken her right hip for this scenario. We're going to roll her onto the injured side. So the scoop's going to go, then force going to go to the left of her. So just make sure that we've got no neck pain or anything, because if we do, we need to do a log roll. If not, then we can concentrate more on the other roll. Right, so the way we're going to do it is we'll have two people that side. We're going to crouch. We're not going to kneel down, but we're going to crouch. So we're going to do this. If we're rolling a patient with a hip injury, we're going to have one under the arm, one there, so your hand will go there, my hand will go there. So then we're going to roll on roll, so I'll go ready, set, roll, and when we do ready, set, roll, we're going to roll, put the barrel there, get the board underneath, and then we're going to wait for ready, set, lower, and then we're slowly going to lower, watching our fingers. Got it. Down.
Crosswalk 6, Crosswalk 1. Do you want the what 3 words reference over?
Yes please, over.
What 3 words reference is passages unto negotiators, over.
Crosswalks 1, crosswalk 6. Further update for you. The patient is led against the building, over.
Just do a quick survey, check they're alive.
Hello? Hello?
Crosswalks 1, for your information, James is now taking over on CPR, over.
Crosswalk 1, ETA 30 seconds for the requested equipment, over.
So what have we got?
Unconscious casualty, not breathing, CPR in the commence.
Okay, lovely. Neil, if you could carry on with CPR for me, please. Scene tape, Rog. So if we could pull the patient out this way, please. So 2-man job. So just making sure we need support seats by my hands. If you're able to hold head, we're going to move that way. Okay, 1, 2, 3. Okay, stop. Okay, and again, and we'll stop with us. So start 1, 2, 3. Stop. Okay, right. James, can you perform a jaw thrust for me? Head tilt, chin lift. And Roger, if I could get you doing CPR, please, mate. Tension pneumothorax, possibly. Hypoxia, not sure. Hypoglycemia. If I could get one of you to start doing some obs for me, please. So right, so oxygen levels. We've taken the oxygen levels as well, the patient's oxygen levels. 80%, okay, we can manage that. 7.3, lovely. Blood sugar levels are fine. Temperature, what's our temperature?
Like 35.
35, a little bit cold, but that's alright for this situation. We don't want to make them too warm for a minute until we get across. We're going to do a log roll, so we're going to do a proper spinal roll, get them on the board, straighten up, and then we'll extricate that way. What we will do is we'll take him to the nearest warm safe place, which is going to be the inside of the goods shed. So we'll get him out around the corner and then inside into the foyer of the goods shed. Right, as James is in control of the shed, so we're going to go on his count. So on the ready, set, roll, we'll roll, and then ready, set, lower, we'll lower. James, when you're ready.
1, 2, 3, roll.
Okay. Lovely.
1, 2, 3, down.
Perfect. We happy with that? On lift. Ready, set, lift. Okay, everyone happy? Yeah. Let's start heading towards the fish shed then.
Anyway, you didn't make sense. I don't know.
Right, okay, so we're going to pass through to whoever's in there. So, Martin, if you want to come the other side of the mic, floor there. Okay, you happy? Right, up and head in. Three rounds. Okay, and lower, ready, set, lower. Perfect.